Be insightful. Pergo Biologics.
Hello, my name is Seung-Ok Catherine Hong, and today I'd like to talk about bruxism, bite, and Botox in dental implant treatment. More than 2 centuries ago, Justinus Kerner, a young German physician, suggested the clinical utility of a toxin extracted from bad sausages, which had caused a number of fatal outbreaks in the Kingdom of Württemberg in the late 18th and early 19th centuries. In 1897, the Belgian microbiologist named this anaerobic rod-shaped bacterium Bacillus botulinum, now known as Clostridium botulinum. However, the first documented therapeutic application of botulinum toxin was not until 1973, when Dr. Alan B. Scott injected a purified toxin, at the time called oculinum, into the extraoral ocular muscles to treat strabismus. It was in 1982 that Caruthers, an ophthalmologist, found the cosmetic potential when the globular wrinkles were removed after strabismus treatment. And in 1991, the Allergan company bought the rights to this toxin, and ever since, botulinum toxin has been synonymous with Botox. So here are some studies that use toxin to decrease bite force and load. In this study, 25 units of botulinum toxin was injected into both masseters, and a T-scan was used to analyze the bite for occlusion and disclusion times. Before botulinum toxin, the bite force difference between the right side and the left side was large, but you can see after injection, the bite force became somewhat similar. Also, the anterior and posterior bite force was more and even stabilized after botulinum toxin injection. Occlusion and disclusion time also differed, but this wasn't statistically significant. Botulinum toxin was also used in the immediate loaded cases of implants. Botulinum toxin was also used in the immediate loaded cases of implanted left, first, and second molars. Injection of toxin on the masseter muscle was performed 1 week prior to implant placement. Although in clinical settings, we are aware of various factors that act on the success rate while implanting the implants, we often overlook the factors of occlusal load. From this standpoint, we can expect that botulinum toxin will play a role in raising the success rate by reducing the occlusal load about 30%. Botulinum toxin can also help orthodontic cases. In this case, SAS was attempted to upright the distal molars behind the implants, which wasn't easy due to the patient's occlusal force. So, botulinum toxin was injected, and after 3 months, movement of the tooth axes was possible due to reduced occlusal force on the implants and on the teeth. Another application of botulinum toxin in implant patients is in the aesthetic area. Patients with gummy smiles have different etiologies. Genetic reasons such as hereditary gingival fibromatosis, medication-related gingival swelling due to phenytoin, a short clinical crown, or delayed passive eruption leading to the crown slightly buried in the gingiva, or vertical maxillary excess, which can be the reason, or a short upper lip or hyperactive upper lip may be the reason for a gummy smile. The action of the upper lip elevator muscles, wing of the nose elevator, the zygomaticus minor and major determines the amount of lip elevation. Botulinum toxin can be used in hyperactive upper lip cases. Hyperactivity of the levator labii superioris aliquinasi muscle, levator labii superioris muscle, and zygomaticus minor cause gummy smile. Injections 1 centimeter lateral to the nasal ala can target all 3 muscles. This point is also called the Yonsei point because it was developed by the Yonsei University professors. This 35-year-old male patient lost his anterior alveolus after a traffic accident. Even after a block bone graft, you can see that the gingiva is seen because of a high smile line, and it's very unaesthetic. So 2 units of botulinum toxin were injected on each side. After 15 days, gingival exposure and the prosthesis exposure greatly decreased. This is pre and post injection images of a patient with a gummy smile. Before, her gummy smile was probably about 5 millimeters. After 3 units of toxin on each side, it was reduced to 2 millimeters. Not just anterior implant cases, but you can use botulinum toxin for your anterior aesthetic prosthetic cases.
Be insightful. Pergo Biologics.